Assalamualaikum friends, today we are going to talk about another very important topic. In the previous class, we talked about that angiotensin converting enzyme 2 can be used by the coronavirus for the attachment and for the entry into host cell. So obviously we know that this enzyme has very direct link with the RAS renin angiotensin system. So it means this enzyme has very direct relation with the hypertension and diabetes and antihypertensive medicine. So today we are going to talk about that is there any kind of relationship between hypertension, between diabetes, ACE inhibitor, these are the drugs that are being used for the hypertension, ARBs, these are also the drugs that are used for the hypertension. Is the relation of these things with the coronavirus, hypertension, diabetes, ACE inhibitor and ARB with the coronavirus. Today we will talk about this lecture, very important lecture. Please stay with me just for 5 to 10 minutes. It's it will not be a that much lengthy lecture. Okay, so first of all let's talk about the basic concept. I will not spare much time over there. Okay, what is this? We know that angiotensinogen is converted into angiotensin 1 with the help of ACE1 enzyme, and angiotensin 1 is converted into angiotensin 2 with the help of ACE enzyme, and this angiotensin 2 is basically a potent vasoconstrictor. A potent vasoconstrictor. It means it will constrict the blood vessel. So it means if it constrict the blood vessel, it will increase the TPR. So if the blood vessel is being constricted, obviously blood pressure will increase. Blood pressure will increase. So in the hypertensive patient, the patient who have high blood pressure, what we do, we need to either we can decrease the concentration of this angiotensin 2, or either we can block the receptor on which this angiotensin 2 is going to act on, and it was called the vasoconstriction. So both of these things can be done. How? ACE inhibitor, angiotensin converting enzyme inhibitor. Like there are some drugs like captopril. They block this enzyme, and this enzyme will be blocked. This conversion will not take place, angiotensinogen into angiotensin 1. And similarly, angiotensin 1 will not be converted into angiotensin 2, and the amount of concentration of angiotensin 2 will decrease, and now the vasoconstriction will not take place and blood pressure will stay normal. Similarly, there are some drugs, angiotensin receptor blockers, candesartan like. Okay, what they do, they block the angiotensin receptor on which this angiotensin is going to act, and it is going to cause the vasoconstriction. When this receptor is being blocked, now angiotensin 2 will not be able to go on this receptor. It will not be able to act on it, will not be able to cause the vasoconstriction, so blood pressure will stay normal. This is the normal function of ACE1 and ARB. Okay, now what is the function of ACE2? ACE2 basically an enzyme. What it do, it will convert angiotensin 1 into angiotensin 1 to 9 and angiotensin 2 into angiotensin 1 to 7. Okay, this is very important point to understand. Okay, now this is the whole concept. This is the normal concept. Now we also know that this is the basically this enzyme ACE2 is basically an enzyme that act as a site of attachment for coronavirus. Coronavirus attach over this ACE2 with the help of spike protein, and it will then penetrate into the host cell, and rest of the mechanism I have explained in the previous class. How will it replicate in the cell? Okay. Okay, now let's see. It is thought that if we block this receptor, if we block this receptor, ACE2 receptor, if we block this receptor, what will happen? This coronavirus will not be able to attach over the angiotensin 2. We have blocked this receptor, so now it will not be able to get into the cell. So most of the people think that these ACE inhibitors who are inhibiting ACE1 can be used for inhibiting the ACE2. These are the drugs, if they are blocking ACE1, might be they can block ACE2 as well. And if this ACE2 is blocked, now coronavirus will not be able to get into the host cell. This is one. But it is not as simple. It is very complicated. So please stay with me. This is not possible. Why? Because we have not any evidence, clear evidence, that any of the drug that is inhibiting ACE1, it will block the ACE2. We do not have any evidence, but we have clear cut evidence that ACE inhibitor and ARB, they overexpresses the ACE2. They overexpresses the ACE2 ACE2 enzyme. So it means we should not take them. Instead, we should think that if they are overexpressing, it means they are inviting the coronavirus into our cell. If they are overexpressing, obviously if the number of this angiotensin converting enzyme 2 increases, it means more the coronavirus will attack over them and get into our cell. So it means we should think that the patient who are taking ACE inhibitor or ARBs should stop their medicine. But again, this is also not true. Let's move toward the third concept. Point number 1, should we use ACE inhibitor so that we can block them? No, we should not use ACE inhibitor because none of the ACE inhibitor has been proven to block ACE2 enzyme as well. Okay. Point number 2 is ACE inhibitors, they basically overexpress the ACE2 enzyme. So the patient who are taking ACE inhibitor for diabetes and for the management of heart failure or for the management of hypertension, they should stop these medicine because they are overexpressing the ACE2. That is the site of attachment for the coronavirus. They should stop. No, this is not true. Now let's move toward the third concept. What is it? Third concept is these hypertensive and diabetic patient, they naturally have overexpression of ACE2 enzyme. It means the hypertensive and diabetic patient, they are more sensitive to coronavirus. Yes, but we will talk about it later on. Okay. Now concept number 4. A recent Chinese research, they have indicated that the respiratory dysfunction, respiratory related complication in the coronavirus disease might be due to the accumulation of this angiotensin 2. Please stay with me. I am talking about a very important concept. The pulmonary complications in the coronavirus disease might be due to the accumulation of angiotensin 2. Now, why angiotensin 2 has started accumulating into the coronavirus patient? Because we know that angiotensin 2 need angiotensin converting enzyme 2 for the conversion of angiotensin 2 into angiotensin 1 into 7. It means this ACE2 is basically maintaining the balance between angiotensin 2 and angiotensin 1 to 7. So we know that in a coronavirus patient, this receptor has been occupied by the coronavirus. So if no ACE2 is free, so obviously the conversion of this angiotensin 2 into angiotensin 1 to 7 will decrease, and the level of angiotensin 2 start increasing. If the level of angiotensin 2 start increasing, we know that angiotensin 2 is very notorious for causing local capillary permeability. This bad guy is responsible for increasing local capillary permeability. If local capillary permeability is increasing, it means it is causing pulmonary edema. So what we do? What should we do? We need this angiotensin 2 to be converted into angiotensin 1. We need the concentration of angiotensin 2 go down, but it cannot happen. Why? ACE2 enzymes are not present. So now what we need this enzyme. We need this enzyme to convert this angiotensin 2 into angiotensin 1 to 7. We need this enzyme to convert angiotensin 2 into angiotensin so that we can we can stay safe from this pulmonary edema and other respiratory related complication. So to obtain this enzyme, what we do, we should take ACE inhibitor or ARB, or if the patient who is taking for the hypertension or diabetes, if he is taking ACE inhibitor or ARBs and he is overexpressing the ACE2, it means he is doing right. He is overexpressing the ACE2. We need ACE2. We need ACE so that this angiotensin can convert into angiotensin 1 to 7. So this is the concept number 4. So now there is a confusion. Either we should take ACE inhibitors and ARBs so that we can convert angiotensin 2 into angiotensin 1 to 7, or either we should stop ACE inhibitor so that ACE enzyme do not express and this virus cannot get into our cell. Now, so this is the reason American Heart Association and another journal, that is Nephro Journal Campus, NEPHRJC, I'm not sure about exact name, NEPHRJC and American Heart Association. These are two very important journals, and they have recommended that the patient who are taking ACE inhibitors and ARBs, they should not stop taking these medicines, because these medicines are not only taken for the hypertension, they are also taken for some serious cardiovascular events like heart failure. So if you will abruptly stop these medication for the fear of coronavirus, you may alleviate your heart related issue, you may increase your heart related problems. So this is the reason they are saying that, and they have said that obviously, as we know that hypertension and diabetic patient, they have overexpressed this receptor, so obviously they are at the high risk for this virus. But they are saying that if you are already taking ACE inhibitor, please do not stop taking, consult with your physician, and then make a conclusion that either you should keep on taking. And similarly, this journal has also recommended, and they have explained in an article that if a patient is taking ACE inhibitors and ARBs, they should not stop, because we do not have clear-cut evidence and we do not have enough data that either these drugs increase the risk of coronavirus. Obviously, this is basically a hypothesis and theoretical background. We need a solid research and solid evidence to stop these medication with the fear of coronavirus. I hope you like this video, and if there is any other update, is there any other research related to this topic, I will keep updating you guys. Thank you so much. Please share this video, like this video, and subscribe my channel, and please press the bell icon so that you may get notification for the future videos. Thank you so much.